Okay, and so just some questions to kind of contemplate and reflect on after that video include, what is your biggest takeaway? Do you think the view of substance use disorder presented here could change how those with substance use disorder are treated? Why or why not? And what do you think could help reduce stigma and improve supports for those with substance use disorder or co-occurring disorders at your workplace? And so now, just to kind of bring things on home, we're going to talk a little bit about what employers can do. And so first of all, when people are becoming a recovery-friendly workplace, it can understandably so feel kind of like a big process. And so sometimes what people want to do is further build out their internal process for rolling this out at their workplace. So for example, some people like to do something with a survey where they kind of collect some data that gives them a sense of where their employees are at and kind of how people are thinking and feeling about substance use disorder and recovery, and kind of gauging if there's a certain level of stigma present. And then they can collect that and then kind of use that to inform their efforts. And then they might kind of evaluate how those efforts go and then kind of hone the plan from there and then implement new strategies. So that's just one example of a process. Parity in policies. So that means treating substance use disorder like you would any other health condition. So for example, if you were going to let somebody who's had, let's say, diabetes take an hour to go to a medical appointment, then you would consider letting someone with a substance use disorder maybe take an hour to go to a recovery meeting or something. Maybe if that person had to punch out, then so does the person with the substance use disorder needs to as well. However, we do have one employer that mentions that he will let his employees actually always stay on the clock, or usually stay on the clock, to go to their recovery meetings, because for him, he sees that they need to maintain their recovery in order to be able to successfully work at the workplace. Also, you want to train supervisors. You want to make sure that they are really behind this, that they know how to kind of speak about this in a supportive way, and that if you've implemented anything like a return to work agreement, that they know that so they can kind of align their approach with that. You also want to reduce the risk of injury, which of course would then reduce the chances of somebody getting prescribed an opioid, which could become habit forming. You can participate in prescription drug take-back events and also safe storage methods for prescription medication. You can get trained on how to distribute Narcan, and you can actually have Narcan on site, and that's another training that we provide. And then some additional things that employers do include adopting a formal mental health and wellness day that can be used for paid time off, and that just encourages people to kind of take care of themselves and do what they need to do. Issue organizational statements that people in recovery are welcomed, hired, and developed as professionals. So through Recovery Friendly Workplace, we do have all of our designated recovery friendly workplaces make a formal declaration to their employees stating that they are participating in the initiative and kind of what that means for them. So that would be a great opportunity to kind of include those sentiments in that statement as well. And then offer peer recovery support for staff and ensure events are not centered on substance use. So we are so fortunate to be able to partner with various recovery community organizations throughout the state. Especially we've done a lot of work with SOS, and so they can do things like offering peer support meetings, especially digitally now, but also sometimes in person, especially before COVID. And in terms of the events piece, we have had employers come to us and say, you know, how can I make my event more recovery friendly? And kind of at a minimum, we always recommend having options. So if there is going to be alcohol, that you would then have some non-alcoholic options that are kind of fun available as well, just so everyone can feel like they can participate. So if you have any questions, we really encourage you to reach out and email us. We also would love it if you followed us on our social media. We do a lot of posts there about our recovery-friendly workplaces and related information and events. We have a Twitter, a Facebook, and a LinkedIn. So thank you so much for watching this today, and we hope that you all stay well. Thank you.